Every year on March 24th, we observe World Tuberculosis Day. It's a day to raise awareness. It's a day to remember those who have been impacted by this disease. And it's a day to reaffirm our commitment to ending TB once and for all. The theme for 2025 is, Yes, we can end TB. Commit, invest, deliver. It's a powerful message. We have the tools and the knowledge to defeat TB. But we need to act now. We need commitment from global leaders, policymakers, and healthcare providers. We need investment in research, treatment, and prevention programs. And we need to deliver quality TB care to everyone who needs it, regardless of where they live. TB is a serious public health threat. It is caused by a bacterium that usually attacks the lungs. It is spread through the air when an infected person coughs or sneezes. Millions of people around the world are infected with TB. In 2023 alone, there were 10.8 million new cases of TB, and 1.25 million people died from the disease. TB is a leading cause of death worldwide. It is the #1 infectious disease killer. Drug-resistant TB is also a growing concern. This type of TB is harder to treat and requires longer courses of medication. The World Health Organization, WHO, and the Global Fund to Fight AIDS, Tuberculosis and Malaria are leading the global fight against TB. The WHO provides technical guidance and support to countries. It helps them develop and implement national TB control programs. The Global Fund is a major financier of TB programs in low and middle-income countries. It provides funding for TB drugs, diagnostics, and other essential supplies. These organizations have set ambitious targets for ending TB. They aim to reduce TB deaths by 90% and new TB infections by 80% by 2030. To achieve these targets, they are working to strengthen TB prevention, diagnosis, and treatment programs around the world. Ending TB requires a global effort. We need everyone to do their part. Governments need to increase funding for TB programs. Researchers need to develop new and better treatments for TB. And healthcare workers need to be trained to diagnose and treat TB effectively. Success stories from countries like Bangladesh, Ukraine, Iraq, and Pakistan show us what is possible. Community health workers are playing a vital role in these countries, bringing TB services to remote areas and ensuring that people have access to the care they need. We can end TB. But it will require sustained commitment, increased investment, and global cooperation. On this World TB Day, let us renew our commitment to fighting this deadly disease and creating a healthier future for everyone.